to Dr. Mauricio Trujillo. Doctor, how are you doing today?
Good. How y'all doing today, too?
So, can you go into the signs and symptoms of heat stress, heat exhaustion, and heat stroke for us so that the public will be aware of what's going on?
Thank you, Stan. I want to start off by thanking you for giving me this opportunity to be here with you all to discuss this topic, which I find is very important, particularly with the weather changes we've been having here in Texas. We've had triple-digit heat days here and as much as a week to 2 weeks, prolonged time period. What exactly the risk that poses to you, your family, your loved ones, and also your pets and so forth. So I want to start off with a discussion how heat illness has a wide variety in terms of severity, starting off with what I would call heat stress, and then the next form going forward in a more intense illness pattern would be heat exhaustion, and then what we commonly hear about is heat stroke. That is the worst of the three. There's two types of heat strokes that we commonly think about. One is the exertional type, which are individuals that are outside working, heavy lifting, exposed to the heat in that format. And the classic type, which is non-exertional heat stroke, which tend to be the extreme age group, the above 70 years of age group. Those extreme age groups are put at higher risk for a number of reasons, are on a number of medications that put them at higher risk for dehydration. In addition to that, the older population have chronic illnesses like hypertension, diabetes, and so forth, which add on to their risk factors. And one thing I also want to bring up, which I think is quite important, is that population group may be embarrassed or not willing to communicate to their loved ones and friends that there might be something wrong in their home. For example, their AC unit might be not working as well as it should. And so I think it's also important, before we go forward on with this presentation, that it's very important to visit with your loved ones, friends, and family members and do a well check on them to see how their home situation is. In addition to that, how their AC unit is working. Because in many ways, this will be crucial in terms of avoiding a heat stroke with this patient population. Going on, I want to begin by talking what is the average amount of water that someone should be drinking on a daily basis. And the recommendation is roughly 2 liters a day with no activity. And to make that a little bit more of an easier perspective how to understand, getting a water bottle that I have right here, this one is 591 mLs, but roughly the average bottle of water is about anywhere from a half a liter, 500 mLs, to this one here, close to 600 mLs. So in a general perspective, you should be drinking 4 of these bottles a day. And keep in mind that a lot of the foods that we do eat on a regular basis do contain water content in there. So don't feel like you have to be exactly on the 4 bottles a day, but that's a good rule of thumb to keep in mind. And this 4 bottles a day for non-exertional activity and non-exposure to the heat that we're currently feeling here in Texas. So many people ask me, well, Mauricio, what if I'm going to be outside working on the lawn, or I'm going to be exposed to the heat longer than I should, or away from the cooling system at my house or the AC unit? And what I recommend is drinking 1 of these bottles every 30 minutes while you're outdoors doing activity. That'll give you a rough idea to be ahead of the game. I also recommend, before you go out to do these activities, try to load up on your water intake or your Gatorade of choice or your Powerade. And for children, obviously, Pedialyte is the fluid of choice for infants and young children. But keep in mind, you want to get kind of loaded up or get a full tank, if you will, in your body of water before you get out to do these activities. So 1 bottle every 30 minutes for activities outdoors, and normally 4 bottles a day for non-exertional activity. So moving on in terms of symptoms and what to look for, I think initially when we talk about heat stress, which is the first level of concern with heat exposure, is the fact that you go outside and to yourself, you're saying, wow, it's pretty hot out here. You're basically talking to yourself saying, you know, I need to drink more water. I'm beginning to feel thirsty. You may start beginning to feel some heat cramps, muscle pain, fatigue, things of that sort. And that's the beginning of your body talking to you that the environment around you is way too hot. Of interest, going along with the normal temperature is, or we call the core temperature of the body, it's 37 degrees Celsius or 98.6 degrees Fahrenheit. It's interesting to note that our bodies are well adapted to changes in the cold environment much better than the hot environment. And so with that said, many times when our body cannot maintain the core temperature 1 or 2 degrees off of those two numbers I talked about, and the more common reason or format that we control our temperature is by sweating. That is very important to keep in mind, because when your body gets to the point where it can no longer sweat efficiently, in situations, for example, we have high humidity, usually humidity percent greater than 75 and above, our bodies are not very well adapted to evaporate the sweat off our bodies. And in those situations where you have a high temperature, high humidity is the top risk or highest risk for you to be severely injured by the heat exposure and a heat stroke. So moving on forward from the heat stress we talked about, the first signs may be heat, cramp, muscle aches, fatigues, and an increase in thirst, and you may notice an increase in sweating. We then move on to heat exhaustion. At that moment, what occurs is your core temperature has gone up roughly around 103 to 104 degrees Fahrenheit, and at that level, other things start to happen. In addition to the things I mentioned with muscle cramps, muscle aches, fatigue, you'll start having headaches, you'll start having symptoms like nausea, vomiting, diarrhea. You may not feel strong enough to continue the activities that you're currently involved in. You may feel a sense of fainting coming on or a sense of low blood pressure, and that's when you need to start looking for sources of help like shade, indoor location with an AC unit that clearly increase your water intake and or energy drink, Powerade, or Gatorade intake, which will help quite a bit to avoid the dehydration which is leading you to this point. Talking about dehydration as well, many individuals ask me, on top of how often we have to drink a bottle of water when we're out working, keep in mind that the color of our urine, I know it's something most people do not like to talk about, actually is a great indicator of how well we're hydrated. If your urine is very concentrated or dark, that means you're probably not drinking enough water, and you're probably setting yourself up for a situation where you could be severely dehydrated and have heat exhaustion and or heat stroke coming on. Moving on to the heat stroke, which is the worst of the three that we're talking about, that's where your temperature may go above 104 degrees Fahrenheit. And at that moment, you tend to have things like confusion. Your behavior may be agitated towards others. You may have a short temper. You may not be acting normal according to those around you, or may perceive you as acting differently. You may feel that you may longer stand up. You may feel that you need to sit down. If not, you're going to pass out. And with that confusion that you may have, and altered mental status, which is the key thing I want to bring home, is anyone that's been exposed to extreme heat and is not acting normal and is acting confused, and in a severe case can actually have a seizure from being exposed to that high heat. That's what we consider a heat stroke. And at that point, you need to seek medical attention immediately by calling 911, and that will begin with treatment with lowering your temperature. One thing you can start at home with your family and loved ones is to place ice packs in areas like the axilla, underneath your arm, or around the neck, or around the groin area, which are the areas of the major blood vessels in your body that will help the cooling process and help your body lower that core temperature from 104 to a more acceptable range around 98.6 to 99. With that said, the majority of these patients that seek medical care, the sooner they seek medical care, the sooner they get evaluated by a qualified health professional to provide IV fluids and cooling processes, the better the outcome the patient will have. One other thing to mention that I think is vital is that the extreme ages of patients above 70 and our younger children and pets, please be very careful with leaving them in an unattended vehicle. Some individuals have told me, well, Mauricio, I keep them in the car with the AC running. Well, keep in mind that if you walk into a store and that vehicle, for whatever reason, stops functioning, or the motor or engine, what have you, stops, then that AC unit also stops and ceases to work. And at that point, the loved ones, your pets, are then at danger and at risk of dying within the vehicle. So my recommendation is never leave a pet, a child, an elderly individual in a vehicle that they may have difficulty exiting in a hot environment like we're having these days.
You mentioned heat exhaustion. What about is that confusion level, is that very high, or is it something I could recognize right off the bat before I can call 911?
Where this situation happens more frequently than we're unfortunately happens in a daily basis is individuals that go hiking. And the answer to your question is, you may not be aware that you're actually getting confused. More likely than not, it's someone near you or a friend that's working with you that would say, you're just not looking right, something's wrong. So it's very important early on to start noticing the signs of dehydration, notice the signs of heat stress where you feel like you need to drink more fluids or you're sweating too much. And at that point, seek help with shaded area which has a nice cooling breeze that can bring that temperature down, and or going indoors to AC. But the difficulty to your question is that the scale of going from a heat stress, which is the most minor of these illnesses we're discussing here today, to heat stroke, kind of there's some gray zone, and people act a little bit differently depending on what their temperature is and how that illness progresses from the heat stress to the heat exhaustion to the heat stroke. But by the time you're a heat stroke, you will not be aware, and many times, especially if you had a seizure, what is going on. And unfortunately, many times these individuals are found dead by their loved ones several hours later because they were unable to seek help and there was no one there to help them during that time of need.
Dr. Mauricio, continuing with heat exhaustion, when this starts to happen and you mentioned the weakness, is it going to be in my arms, legs, heart, head, where?
So that's a great question, Stan. I think the reality is it depends on what muscle group you are using at that moment. So if you're doing running, or it'll probably be your legs, your thigh muscles, or your proximal leg muscles that will be hurting first. And if you're, let's say, example, shoveling something, then your arms and your upper body will probably be the areas that would be cramping. Keep in mind as well, as we discuss this, a topic that has come up often, one thing that we've researched quite a bit is young athletes that are performing sporting events, primarily American football, are the ones at greatest risk of injury during heat exhaustion and heat stroke. And keep in mind, part of that reason is they're wearing a helmet, they're wearing pads, they're wearing jerseys, they're wearing quite a bit of equipment that inhibits or makes sweating that much more ineffective for these individuals. So if you're able to wear light clothing in a shaded area, that's going to be your best scenario to avoid this illness from progressing.
What reactions are we noticing on your skin surface?
So great question, Stan. One of the ways the body regulates the core temperature is by sweating. I've already alluded to that. Well, how your body does that is it goes through a process called vasodilation. It's a fancy term. I don't want you to really go into deep about that, but what it means is that your blood vessels close to your skin area will dilate or get larger so that more blood flow can go to that area, or in this scenario, more blood that's higher temperature than it should to then be exposed to your skin and allow it to sweat. And through the evaporative process, it cools the skin and also cools the vessels that are near the skin. With that said, sometimes you may see a patient, when that happens, they may feel flushed or the face areas of their body may look redder than they normally do, and that's what we talk about feeling flushed or looking flushed. And many times that's how the skin will look on these patients that are beginning to show signs of heat exhaustion and heat stroke and excessive sweating. With that said, Stan, what I want to be careful to the individuals seeing this presentation is that we all sweat differently. Some of us have those friends that sweat a lot, and some of us have those friends that don't sweat much at all. And that's why it's difficult to make recommendations for you all to take to heart exactly what situation you're in. I think one of the take-home points from today's discussion is just try to hydrate yourself as much as possible before an event and during an event, and that way we can even avoid discussing what are the telltale signs of being in the heat stress, heat exhaustion, and heat stroke. So prevention is very, very important with this topic.
Okay, Doctor, one last question on heat stroke before we close out.
Yes, sir.
In the notes or somewhere I read that you can give a patient who is suffering from heat related issues water, but with a heat stroke that is not feasible. Is that correct?
So with a patient with a heat stroke, the thing to keep in mind is because they have an altered mental status or they may have had a seizure, we need to be careful giving them fluids by mouth when someone's having a seizure, because that fluid may enter the lungs as opposed to going down the esophagus and into the stomach. So really, what I think the main focus on, the first aid help you can do for someone that you have seen or witnessed having a heat stroke is immediately remove them from the environment that is excessively hot. And if that's outdoors, and bring them indoors into an AC or well-ventilated area or a shaded area, and immediately seek help by calling 911. The next step I would probably do to improve the cooling process is to place ice packs underneath the axilla or armpits of the individual, also around the neck and the groin, and that would help lower the core temperature. But sometimes if you're a family member or loved one or friend that you're trying to help out going through this heat stroke process, they may not have the mental capacity or be awake enough to actually drink whatever fluid you're trying to give them. So use caution when doing that. Clearly, if they are able to drink fluids and they're awake and you have access to fluids, please administer them and have them drink the fluids. But be careful with that, because they can sometimes be confused and difficult to direct. I alluded to this before, is please, during these times of excessive heat, try to stay indoors as much as possible. If you're going to do extraneous activities, make sure you tell someone else what you're doing, where you're going to be at, just in case they can check up on you, and make sure that you're adequately hydrated during those activities. The patients that are the most at risk during these heat waves that we're currently going through are our extreme age groups, those above 70 years of age and those that are younger, children and infants. With that said, please go check on your loved ones, friends, neighbors, and check up on those individuals and see how their AC units are working and see how their home condition is. Many times they're embarrassed or don't feel comfortable telling others that they do have a problem, and maybe just going over and checking on them will save a life. And keeping well hydrated before and after activities and during activities that I alluded to before. 4 bottles of water a day minimum, and if you're doing exercise, think of 1 bottle of water or 500 mLs or a half a liter every 30 minutes, and this will protect you and keep you going strong in whatever activity you are doing, and keep you around for your loved ones. Thank you.